Hello and welcome to Differential Discussions. I'm Melissa.
And I'm Dave.
And today we're here to continue our guest series where we bring guests on to talk about various different topics. And today we have MaryAnne with us, who's going to talk with us about intercollaboration between the healthcare disciplines, starting in the classroom. So MaryAnne, welcome.
Hello, so happy to be here. So I'll just give you a little bit of information. I've been, in this profession for 22 years in the lab, and about almost 7 now in an institutional educational setting. So I've had a lot of experience with intercollaboration, interdisciplinary, and then interprofessional programs. So healthcare disciplines within a healthcare team. So, beginning in the educational institutions was really eye-opening to me, because this is where I think we can kind of learn to break down the silos, and our profession can have a voice in the beginning prior to getting to the healthcare setting, so they feel like they contribute more than just a lab result.
Mm-hmm.
Yeah.
I think that's a great point too, because it'll start in the schools. And I know a lot of time in the universities, nursing is right next to med lab. And usually it's just to each other and not actually collaborating and interacting with one another. And I think having that collaboration starting at that stage can start the educational process. This way, once they get into that working environment, they're not to each other. They already have that rapport built. So MaryAnne, can you share with us what experience you have doing this at the student level? What sort of collaboration activities you have experienced? Sure.
So I'll start off with we're accredited program, but we are not mandated yet by the ASCP to have an interprofessional course. So within our curriculum, sometimes it's really hard to build that, right? So our group, it's a small group, and usually faculties across these professions have small cohorts. So you can make a class that's similar to like a simulation laboratory. So we kind of did that. We did a simulation lab where each discipline mimics benches within a hospital. So why not create one of the benches where you have to call critical results? So sometimes you have to make your own opportunities. So in this instance, let's say I made a core lab, I made heme, coag, urines, and body fluids. I said, okay, so you're going to do these benches, but you have these results to look over. Let's get nursing involved. We did a whole day. So I honestly just emailed, the College of Nursing to see who is interested in doing this one-day collaboration. Honestly, you'll be so surprised at how many people are like jumping at the bit to say, oh my God, this is a great idea. So of course, every year I have no problem getting nurses. They have one day together. We have benches where the students explain their role. They're making smears. They're looking over the CBC. They tell nurses it's not just an H&H you're looking at. Like, this is how we get these results. This is why. This is how long it takes, right, to get these results. This is why we reject the specimens sometimes you give us, right? So at this point, they're learning from each other at the institutional level, so there's no backlash. And then we talk about respect and communication. Like, this nurse is someone you need to get on the phone. You need to have a good relationship. So we also build not just, knowing each other's profession, but the respect for each other's profession and what they do. Then we go over a couple case studies, and then they learn each other's role, and you can see how eye-opening it is before getting to the clinical setting. I've also done this with another lab profession. We have pathologist assistants within our program, right? We're learning anatomy, right? We're on a chapter of hematopoietic organs. I reach out, do you have a cadaver that you can prosect to talk about the spleen, show them the bone marrow, show them where the lymph nodes would be, how the circulatory system would work. So, you can make your own interprofessional events because we have some autonomy within our classrooms, right? So you can do that with other health professions too. If you have an interprofessional collaborative group within your college, within health sciences, that might be an easier way to do that by creating an event. But if not, take the opportunity to make your own interprofessional event. So that has been my experience, is just making my own. And then it just, growing into a bigger thing at the academic level.
That's very interesting. Yeah, I kind of, obviously, I always kind of think about when I want to get two groups together, how do we align incentives, right, for them to work together? And so when I think about nurses and lab personnel, right, like our roles are somewhat like same level, sort of, right, but different. And we do have a common goal in facilitating patient care, but we also have different difficulties in the profession, right? So when I think about like, why does a student, where does the friction really happen? And I kind of think about our role in talking about how the functions of the hospital work. So for example, I'll have students ask me about situations that come up in the lab, right? So they want my anecdotes, and I can see that they're maybe a little eager, and they want to hear a story. And I've been trying to be mindful about the types of stories that I share, right? Because I think sometimes we can share. I'm sure we've all had difficult interactions in our profession. It is a stressful job for all involved, right? Our physicians, our nurses, and us are under a tremendous amount of pressure sometimes. And with that stress and pressure comes emotion. So I wonder how many times we as instructors maybe talk about these difficulties and these really isolated sort of experiences, right? Like, I mean, maybe some of the negative ones are some of the more memorable. But they're certainly not representative of our general day-to-day. So I'm trying to be careful now. I'm more reflective on the types of stories I share, so I don't create I wonder how much of a role we might have in maybe making some of that early, so yeah, sorry, just
no, that's a good point, because we all have those stories, right? We all have an angry physician, and so this is good, like, keep telling those stories, but maybe a story about how you de-escalated that physician, because you could be understanding what happened in their situation. They need to discharge, they have rounds, they have surgery, they have whatever they have families screaming at them, like, so who knows what could be behind the story. But in that simulation, I call as an angry physician, and they practice because it's not as high stressed, right? So this is where they can make mistakes. And then this is where they can learn to build that rapport, learn to handle difficult conversations. They have to handle conflict in addition to the high stress of their job. So no, don't stop those stories. Just, the story is ending would turn out with a good relationship, or you learned, or, this happens a lot with nurses. Just give me the result. Like, I have to go, and then say, okay, sorry, you're having a bad day. What can I do for you? And I check in, or just a quick, like, I understand what you're going through. They're like, oh, I'm sorry. I don't know why I did that. That wasn't on me. That wasn't you. And then you build that rapport, right? And then they'll call you and ask for you by name. Like, it's, you create so many opportunities by like one little check-in or one little thing that could have shifted the mindset of, this is nursing again, or, right? So yeah, I mean, in the healthcare setting, we kept seeing rejection of specimens like over and over and over. And instead, we're like, okay, so do we want to do the same thing and try to expect different results? Or do we want a seat at the table during nursing orientation to talk about specimen collection? So, you know what I mean? So whatever your role is, reach out to, and this doesn't just have to be like a supervisor. You can be year one just written your boards, you find something that you don't like that can be improved, and you have a positive solution, right? Say you'll take it on. Just give me a contact, give me something. Like it can happen. I've seen it so many times. Like I've been even invited into the operating room to get pathology specimens delivered to us in a way that will work with us. So I've given talks to nursing about blood products. I mean, I went to the bedside to talk about blood products to a patient because the nurse is like having a really hard time explaining plasma. And I'm like, yep. And then we'll do that. If they know that we are willing and eager to have that seat at the table. So we need to build a voice better because we've been so quiet in the basement or no window or whatever. We're done with that. Come on, CLS, MLS. We need to do this ourselves. So no one's going to do it for us. So,
and that you brought up an interesting point too there. So how much of it? So when we talk about different personality types and how they might be attracted to certain roles, I have this image of a med tech in my mind, right? And this is totally a stereotype. Okay, totally a stereotype. But generally, you have a thoughtful person who's an introvert, right? And generally maybe conflict averse. And so when I think they get to, we're so comfortable being in the basement. So, you'll have, on the one hand, we'll complain about being in the basement, but I think very many of us are very comfortable in that basement. So it's tough too, right? Because and then maybe someone who works like frontline healthcare, our clinicians and our nurses, maybe they're a little bit more extroverted, a little bit more assertive, right? So do you feel that might be a component of?
Definitely. So there's definitely the people that are willing to go out of their comfort zone to make positive change. And then there's people that have really good ideas, but are like, I'm not doing that. Like I do not want any part of this at all. You know what? There is always one person that will willing to go to bat and be listen to the person with the idea, even if they're cranky. Listen, the crankiest med techs that I've worked with have been the smartest. They know their stuff inside and out. I love those cranky techs, right? So, they have so much to offer, but because it's been so long that they haven't had the change that they wanted, no one voiced it for them. So there is one person for sure that's willing to be like, I'll do it. I'll go talk to blah, blah. I'll go make this connection. It's just collaborating and listening to their complaints and making it productive or, somehow, what would you want to see then? How would you like to see that changed? And you're like, got it. Blah, blah will go speak on your behalf. And then guess what? If it doesn't change, what's the worst that'll happen? Like you're in the same spot, right? So.
Well, and one of the things that I think is so important is when you start it at the student level, then the nursing staff understands what the laboratorians know. Because I think a lot of times is just different healthcare professions don't understand what is your job, like what do you have to go through to do your job. And so I think having that intercollaboration at the student level allows the nurses, the PAs, the pathology assistants, or the physician's assistants or the radiologists to know exactly what each other does. And then this way you can say, oh, well, I don't understand what plasma is, but I know the lab does. So let me call them. And I think it's better that way because they have a better understanding of their jobs. So if I could tie this back, MaryAnne, when you have the students interact with one another, the different professions, let's just use nursing and MLS. Sure. Do you use like senior level MLS and senior level nursing, or do you try to inspire that at like, I guess, the lower levels of college education, like sophomores or something?
So we get the students in their junior and senior, they're with us. So they do 2 years prereq. So honestly, it was day one, hematology. I go, we're doing, intro to heme, but my pro-section experience came up that day. I'm like, guess what? After heme lab, we're going right into the anatomy lab with cadavers. They're like, yes. So you can do it as early. I mean, you wouldn't go as extensive or like maybe work with like I wouldn't have my students working with other students on a case yet. But by the spring of their first year, they're working with nurses. By March of their first year, they're working with physician assistants and talking about urinalysis and why we do QC, why it's important, so these are the foundations that no matter where they are in their educational career, then they bring some value. In their second year or their last term, we have an event with 9 healthcare professions, right? Where it's just a case study, and it's better case study based because everyone has a part in this patient's whatever. What I found really unusual is nurses know who we are. They have a basic understanding, even at the like educational level, undergrad. The physician assistants, they really, this is like their 3rd year. They're like, oh, you guys are like a thing, like you're a profession. I thought these labs, a machine just spit out a bunch of you guys really know like how to diagnose based on these. Like they were shocked. And so I'm trying to get the School of Medicine, because really, I mean, that would hit home, right? So it's taken me a year to get on it. They're interprofessional. Don't stop trying. I mean, whatever you can do, just keep going. So
Those
MaryAnne,
are some of my most memorable. Oh, I'm sorry. Go ahead, Melissa.
can you elaborate on your day with the 9 different disciplines? What disciplines are involved? How do you do that? Like, what sort of case study do you use that incorporates all of the disciplines? And
sure.
Do the students give presentations, or how do they interact?
This is a committee. It took us a year to get this. We also have a publication, second one in the works about it. We have CLS or MLS, pathologist assistants, mortuary science, OT, PT, nurse anesthesia, radiation technology, radiological therapy, physician assistant, pharmacy. So obviously there's a lot going on with this patient. We have a patient that's homeless. He's a vet. He's a substance abuser. He has a shoulder injury. They find mesenchymal sarcoma. They do amputation. They do radiation. They do therapy. And then the patient gets COVID at the hospital and dies. Boom. It covers everybody. And so for the first hour, we talk about each profession. Each profession has a few minutes to talk about that. Then we go into breakout rooms for another hour and a half to discuss this case study. So we not only talk about the case study, but we talk about the ethical implications of how this patient might have some medical mistrust, especially from, their situation. And then we talk about what we've learned. What have you learned from each other's profession? And then we come back and we have an expert panel for each of those professions, and students ask questions. So it's a 4-hour event. I know it's long and it's virtual. It's been virtual for the last couple of years, but I have to say that this is probably one of the best interprofessional events that I've ever been a part of.
It sounds amazing.
That's so cool.
I'm kind of like, hey, Dave, stop being lazy, right? That's what I'm thinking in my head. Pick up
but
the phone.
We also have
Dave.
a committee, right? Like we have a college interprofessional education committee. It's a little bit easier. Like those other like offshoots with physician assistant or pathologist assistant or nursing, I kind of made my own. So you don't want to create so much work for yourself where you're like, I can't even I got to teach, I got to research, I got to serve, like where you can't handle like running one of these events. So, you need some support in some of those bigger multidisciplinary groups.
And I think the smaller, when you have the smaller groups, it's almost the students can interact a little bit more and they can teach one another. When you get to the bigger groups, you could do it, but it's probably a little bit harder.
And it's harder, and you have 3 pharmacists to want, like, it's more intimidating because again, okay, I'm going to go back to that stereotype. It is present. We don't like talking a lot, like we'll talk about what we own and then, we'll just stay quiet. So it's really difficult for them to come out of their shell. Some are like, I'll do it, and some are like, I don't know if I can do this, so it's definitely good. But yeah, one-on-one, like one profession to another, where it's equal ratio of that profession, like nursing, of course, it's 2 or 3 to 1, but they do feel more comfortable than in a group of 10 different professions, right? So
yeah, that's a good point, in that our classes are generally smaller in size compared to these other healthcare professions, in part due to, well, we're introverts. A lot of people don't know, but in part due to our lab size. We can't have 50 people in a lab, whereas if you're doing a nursing sim lab, you can probably have more students in there than we can have in one of our labs. So that's another good point to take into consideration. Whereas you have different ratios. Typically you're going to have less MLS students in comparison to the rest of the healthcare professions.
Yeah, and the more you introduce them to these events, like in education, the less stressed they get about doing bigger. So it kind of gets like bigger and bigger, and so they're like, okay, we're ready, it's kind of something like
that. It sounds awesome. I mean, I don't know how else to describe it. It's definitely something I want to try to pursue, because I do think it's important. I think it makes just healthcare so much better. If day one, they have this team mentality, you understand your role, and the greater understanding of others' role, right? I think that's what you're really building. So that's awesome.
I mean, even interprofessionally, interdisciplinary. Okay, how does this case, like, just say that agglutination case. Okay, now let's go look at and pull our info from blood bank, or let's talk about hemolytic anemias and let's get blood bank in here, or, I mean, we could even collaborate. Being from Michigan, Maine, we got Massachusetts. How are our differences? I was also trained in Canada, so how do these perspectives come into play when we're all 3 of us talking about hematology? Like, that could be something too.
So true.
Absolutely. There's so many opportunities for it in our profession. And like you were saying too, even within our own MLS, bringing in blood bank or micro or chem, because we're so even silo ourselves. And in part it's because you have to learn this information about hematology in order to be successful on your boards. But it's so important to tie together the blood bank and the chem, because that's what you're going to do in real life.
For sure. Yeah.
So MaryAnne, if you had a piece of advice for, say, Dave or myself or another educator listening, so how do you start getting this going? Maybe not on the big scale, I guess that's the end goal, but give us one, nugget of how should we get started if we're interested in starting an intercollaboration program with other health disciplines?
Okay, so first, what disciplines are within your college that you'll have easy access to? How supportive is your program director to help contact you with the right people? If not, and I'm not knocking any program directors, but if they're not really thinking this is a value add because there's other things to do, who do you know, right, from a service committee that is from another profession that you can say, hey, what are you teaching this semester? Or, maybe can we collaborate? Is that something that you would want to do? So, those kinds of things are the beginnings for who's around you, who can help support you, who do you know from other committees, and just start small, and just get ideas from each other, because someone might already have something kind of ready, or planned, but they can't just execute this one portion of, understanding this. Or, you know what, I teach this and I have such a struggle with, this portion. Oh, that would be great. Like they don't even think, that it's a possibility until you start having conversations. So it's really just like getting curious. That's really the first start. And if nursing is not close to your college or you don't have, I go on the College of Nursing website, look at their faculty, see what courses they teach, or, see if they've done any intercollab, and I just email them. Hey, I'm, MaryAnne Stewart. I'm one of the clinical faculty over here. This is what we do. This is what I'd love to do. Is there anything, or any idea that would come, into your program or profession that we can collaborate? So really start small, and then you don't never know how big it can be.
That's great advice. That's a good place to start, small, and then eventually work up to that huge intercollab day, which is such a cool event. So I think that's all we have for today. Yeah. MaryAnne, Dave, and I really want to thank you for coming on, spending some time with us, and sharing your experience. We definitely appreciate you.
Thank you. Yeah, I had such a great day. Thank you so much for inviting me.
Of course. And everybody else, thanks for watching.
Thank you.
Please like, subscribe, and hit the bell if you'd like notifications whenever we post a new video. And feel free to reach out to us on social media or via email with comments or suggestions about future content. Thanks.